किसी को कोई
Will
पॉइंट
I
आ सकता है?
continue? I think people will ask questions if they have any.
Okay, ठीक. So how can it boost your CV for jobs locally and internationally is that internationally, wherever you prepare for koi bhi exam, if you go to USA, if you go to Canada, Australia, तो वहाँ पे it's very critical to have research experience with you, right? Locally, be when you consider FCPS or any other postgraduate degree that is offered in Pakistan, तो वहाँ पे पहले a few years back, there were 6 marks allocated uh, to doing research. If you had published 2 articles, then you would have gotten 3 marks each for those articles that were published, right? So अगर हम बात करें the hospitals that are really good, so Aga Khan, if you actually want to do your residency there, अगर आपने वहाँ पे postgraduate residency करनी है, so even in their interviews they ask if you have 5 publications at least as first authorship, right? First author अगर आप हो, so so that's why it can really boost your CV for all of these systems as well. It can contribute to local healthcare. कोई भी आप research करो, you understand on the basis of all the databases and journals what is going on globally. अगर आपको globally पता चल रहा है what is happening in your field, that can really contribute to you working on improving the setup that is given to you locally as well. You can learn different soft skills. So when I consider soft skills, अगर हम कोई भी research की बात करें, we work in a team. We work in a way in which there are multiple authors to one thing. You can be the first author and you can lead a project. आप उसमें क्या सीखते हो? You learn how to delegate things, right? So delegation से क्या होता है? You understand what are the strengths and weaknesses of a certain individual, what are the things that they can do and what are the things that I cannot do. So accordingly, you give them the tasks that they can perform, and that's how you learn how to make your way out of chaotic situations in which deadlines are not being reached. You understand how to have those leadership skills. You understand delegation as well. You understand time management very well. So, and if you conduct autonomous research, you're learning analytical skills. You're learning how to use databases. You're learning how to use different softwares, and that can contribute a lot to your skills overall. आप अपने आप को market कैसे करते हो? आप अपने आप को how do you gain projects? There are multiple resources for that. So such as LinkedIn, there are multiple ways in which you can reach out to more people like you, and that's how you can even do networking with other people. So all of these soft skills will help you out in your career, not considering the academic point of view only. It prepares you for academic careers. जब हम लोग बड़े होते हैं, we always when we always think about what we want to do when we join a certain degree. अगर हम लोग doctors बन रहे हैं, we either want to be physicians or we want to be surgeons, right? या फिर हम लोग चाहेंगे कि we want to be a cardiologist in our field. So अब अगर हम लोग देखें तो there is many the field of medicine is very vast. आपको preparation, you can prepare for academic careers, you can even go into research as well. Postgraduate research fellowships hoti hain in developed countries, and you can actually, if you're very interested in research, you can go for that as well. There, you're not limited to this aspect only. So so I was just going to discuss ये कुछ common terminologies हैं जिसमें सारे confuse होते हैं कि एक journal और database में क्या difference होता है. You hear a journal all the time, you hear what a database is all the time, but we get confused regarding these terms. A journal is basically a periodical that publishes research articles in various study designs as volumes and issues, such as the Lancet or JAMA. कोई भी article आप publish कर रहे हो, think of a journal as a library where all of the articles are placed in one whole library, and all of those articles are only relevant to a specific topic. आप कार्डियोलॉजी का कोई भी आर्टिकल किसी एंडोक्राइनोलॉजी के जर्नल में नहीं सबमिट कराओगे, right? So that's what a journal is. A database is a platform that stores millions of studies from multiple journals and research sources like PubMed or Cochrane Library. बहुत ज़्यादा journals are affiliated with a certain database. This is called indexing. So whenever a journal is indexed in a database, all of the studies in that journal are placed in that database. PubMed is your largest database right now in the whole globe. So journals provide individual articles while databases give access to many journals. When we consider what an impact factor is and what is indexing, an impact factor is a measure of how often articles in a journal are cited, indicating its influence in the field. कभी भी अगर आपने कोई भी नंबर देखा हो किसी भी जर्नल के आगे कि 0.61 3.4, these are all its impact factor. ये basically एक simple way में it just shows how good of a journal it is, how much is it being cited, right? कितने लोग उसे देख रहे हैं, कितने ज्यादा लोग उनके journals के को refer कर रहे हैं in their studies. So it indicates its influence in its field. Indexing is how journals are listed in databases like PubMed or Web of Science, which helps researchers find reliable resources, right? Both are valuable because they reflect the journal's quality and credibility, guiding researchers in selecting where to publish or find information. So, we're going to discuss the letter to an editor, but we're just going to थोड़ा सा अंडरस्टैंड कि जो भी रिसर्च होती है वो किस तरह से हायरार्की में डिवाइडेड है so that we can understand where we stand if we publish a letter to an editor or an expert opinion. So this is the study, design, and hierarchy of the system. Umbrella reviews, meta-analysis, and systematic reviews are very, very high impact. Their original articles जो होते हैं उनमें RCTs आते हैं, randomized control trials, case control studies, cohorts, cross sectionals. Cross sectionals में एक उनमें से cap studies होती हैं जो कि कभी-कभी आपने देखा होगा कि कोई कॉलेज का स्टूडेंट आपके ही क्लास में आके पूछ रहा है कि यार ये सर्वे फिल करो, right? So those surveys are nothing more than cross sectional studies at a small period in time. Where then there are cases, case reports, and letter to an editor or an expert opinion or any background information is comes under the lowest part of the hierarchy. But I've bolded something right at the end of the slide that every published article has impact. ज़रूरी नहीं है कि आप meta analysis, reviews, umbrella reviews, systematic reviews publish करो तो only those are impactful on your CV or in the healthcare community. कोई भी letter to an editor या छोटी चीज can also have a lot of impact, and we will discuss that later on. The letter to an editor is basically a form of an opinion. It is a concise communication submitted to a medical journal responding to a previously published article or addressing a relevant issue in healthcare. It allows authors to express opinions, share insights, or raise concerns about clinical practices, research findings, or public health matters. This format fosters dialogue within the medical community and can influence future research and policy discussions. So, एक तरह से अगर हम इसको थोड़ा सा समराइज कर लें, इसकी दो तरह से लेके चल सकते हैं। एक क्रिटिक भी कर सकते हैं और एक जनरली हम एक ओपिनियन और एक रेलेवेंट इशू को डिस्कस कर सकते हैं, व्हिच वी वांट द हेल्थ केयर प्रोफेशनल्स और अदर पीपल इन द हेल्थ केयर कम्युनिटी टू एड्रेस दिस। ये एक छोटी सी एक फॉर्म ऑफ कम्युनिकेशन है और a small essay in which you express an issue of a previous article that could be a critique, or you express something which you feel that is important in the public health context. So, as I discussed, there were two ways in which you can write a letter to an editor. एक critique भी लिख सकते हो, where you're basically criticizing in a polite manner something that was previously written in an article that you're discussing in a specific journal. So, a polite correction or criticism to an already published article on a topic, it is directed towards the editor, mentioning the author, and is always submitted to the same journal as the article, right? Critique जो है आप किसी और journal में नहीं submit करा सकते. If you're referring to that article, you have to submit it on that in that specific journal as well. A general letter or commentary is an evidence-based opinion on a lacking area in the field of medicine which you feel needs to be discussed. So these are the two ways कि आप इसको एक दो तरह से आप लेके चल सकते हो, where you're criticizing an already published study, right? You're finding some errors in those, या फिर आप किसी एक चीज को डिस्कस कर जो पहले it's not been talked about. There are three components to a letter. Letter को आपने paragraph की form में नहीं देखना. आपने ये देखना है कि when I am writing a letter, am I addressing these three components? कि आप ये नहीं देख रहे कि उसकी पैराग्राफ फॉर्मेट में आप किस तरह से उनको मेंशन कर रहे हो. The first thing is the introduction, then the body, and then the conclusion. इनकी word limit varies across every journal. सबकी हर journal की अपनी requirement होती है. It takes a long time to actually understand that requirement and fix your letter according to that journal. तो जब भी आप website में जाते हो, you go to their instructions, you go to the instructions for authors, कि मैंने font कौन सा use करना है, words should I use, how many. Am I still audible? Hear me? Am I? Uh,
Okay, hi everyone. I think Abdullah's having some issues with his internet connection, so I think I'll share my screen for now and we'll continue from where we left off, and then Abdullah can start again once he's back in the meeting. So just give me a minute. Okay, so I think we were at the components of a letter to the editor. I hope my screen is visible to everyone. So
Yeah, Iman,
it
it is.
Okay, thank you, Noor. So an LTE is usually of 300 to 500 words. Obviously, the requirements can vary according to the journal requirements. That's also something that you need to be very careful about. Whenever you're writing an LTE, you need to make sure that you have a target journal in mind, and you need to ensure that you go through the author guidelines and that you write according to the author guidelines, right? So the basic components of an LT include an introduction, a body, and a conclusion, right? So the introduction is obviously going to state the purpose of the letter. You're going to introduce the problem that you're writing on. So for example, if I'm writing on a new drug that's being developed, right? If there have been a few RCTs that have been published on that drug, on that particular drug, I'm going to introduce and talk a bit about, firstly the drug itself, right? Um, how many RCTs have been conducted on that particular drug, and maybe, introduce a previously used drug that has a few side effects, and why this new drug is needed for, whatever disease it's targeting, right? This is a very general outline. Obviously you can change this according to, whatever is being published in the journal previously as well. One advisor I'd like to give to everyone is to make sure that whenever you're targeting a particular journal, do look at the previously published articles in that particular journal, right? That does help you in, sort of gauging, okay, what exactly do they like to see? What exactly do the editors like to see? And what exactly do they like to accept, right? Okay, so that's the introduction. Then in the body, you're going to talk about something new. So as I mentioned, as I talked about, writing on a drug, for example. So what would be something new in drug development? Obviously, it would be an RCT, right? So I'm going to talk about the results of a randomized control trial. कोई एक RCT हुआ है, उसकी वजह से मैं LT लिख रही हूँ, right? So I'm going to talk about the results of that RCT. And this is usually the biggest part of your LTE. This forms the main content of your letter to the editor, and this usually consists of 200 to 300 words. ठीक है? उसके बाद there is a brief conclusion. You can mention, that you can stress on the fact that more research is needed for this particular drug or any disease or whatever you're writing on. ठीक है? जो मैं drug बार बार कह रही हूँ, that's just an example. You're going to summarize the key points, okay, and suggest any recommendation, implications, and for clinical practice or future research. You're going to stress, okay, like for example, this is a phase 1 trial or this is a phase 2 trial. So we need to make sure that we also conduct phase 3 trials, and that we conduct these trials in a wider population, in a more diverse population, to see the kind of impact that it has, and okay, kya results aate hain, and if it's as efficacious and as safe as other drugs are, right? Okay. And here we've added that tables are not required, but one can be added. Again, this varies according to the journal's requirements. Okay. References are not required, but many journal require. So in my experience, references are always required. Whenever you write something, you need to add a reference. Okay. आपने एक definition भी लिखी है ना, you need to add a reference. जो आपने facts लिखे, you need to write a reference. But then again, the problem with an LTE is that they usually have a requirement of, like 5 references. इधर यहाँ हमने लिखा हुआ है, the usual range being 3 to 5. That's absolutely correct, right? And tables ka bhi, it really depends. So as I said before, have a target journal in mind and then start writing. ठीक है? और target journal आप किस तरह से ढूंढ सकते हैं? By looking at where other people are publishing. Okay. So this is more detail about an introduction. Include a reference to the article, mention very few lines, the important medical terminologies used in the letter. Obviously, this is very important. आपने introduction का मकसद यही होता है कि you're defining the problem, right? You are going to define the terms. For example, they've mentioned gastroenteritis as an example. So you're going to briefly talk about gastroenteritis. You're just going to define it. Obviously, the introduction is usually of 50 to 150 words. So you can only define a few terms in a very few words, right? And include a reference to the article. What this means is that if you are writing a critique on a particular article, right, or if you're writing an LTE on an RCT or any other original study, ठीक है, necessary नहीं है कि आप critique ही लिख रहे हो. Obviously जब drug development की बात होती है या किसी intervention की बात होती है, then obviously you're not writing critique on the RCT, you're just writing on, you know, the new developments that have occurred in recent times, right? So in that case, the first thing that you should do is refer to that article, कि आप introduce कर दें कि you know ये drug है, इसकी ये recently ये publish हुआ है RCT, ठीक है, तो वो first reference होना चाहिए, ठीक है. Again, this is not a rule, this is just some advice that we're giving you, ठीक है. उसके बाद discuss known knowledge of the topic and purpose of the letter. Again, this could include, for example, क्या एग्जांपल दूं मैं, कोई न्यू ड्रग आया है, देयर इज अ ड्रग कॉल्ड car-XT फॉर द ट्रीटमेंट ऑफ स्किज़ोफ्रेनिया, ठीक है. उसकी इट्स अ मस्करेनिक एगनिस्ट, ठीक है. तो उसकी डेवलपमेंट हो रही है, ठीक है. देयर आर अ फ्यू RCTs ऑन इट. तो उससे पीछे लाइक फर्स्ट जनरेशन एंड सेकंड जनरेशन एंटी साइकोटिक्स ऑलरेडी यूज होते हैं फॉर द ट्रीटमेंट ऑफ स्किज़ोफ्रेनिया एंड ऑब्वियसली अदर साइकोटिक डिसऑर्डर्स, ठीक है. सो व्हाट यू कैन डू इज यू कैन राइट अबाउट दोज ड्रग्स, यू कैन राइट अबाउट गाइडलाइंस, जो जैसे किसी सोसाइटी की गाइडलाइंस होती हैं, ठीक है. राइट अबाउट दोज फर्स्ट, ठीक है, एंड देन talk about why those drugs that are already recommended by, you know, medical societies, कि ये क्यों नहीं अच्छे. Why do we need new drugs, right? Maybe side effects हैं बहुत ज़्यादा, कोई issues हैं बहुत ज़्यादा, maybe compliance कम होती है, right? हो सकता है कुछ drugs ऐसे होते हैं which you have to take, you know, 4 to 5 times every single day. तो उसमें if you compare that to a drug that you need to take only once every day, that's going to increase patient compliance. इसी तरह से हम ophthalmology में पढ़ते हैं कि जब हम prostaglandins जो होते हैं वो you have to take them only once a day, right? Compare that to beta blockers or other drugs that you need to take several times a day. So prostaglandin analogs, they increase compliance, right? So that's the goal of drug development, कि हम मतलब फायदा क्या हो रहा है उससे. And that is what we're going to discuss in the introduction. Again, very, very briefly, because the introduction is only going to be of 50 to 150 words. For a critique, go straight to addressing the editor and mentioning the positive contributions of the author and the study. एक चीज होती है सैंडविच टेक्निक. जब भी आपने किसी की बुराई करनी है ना, दिस इज नॉट जस्ट फॉर द क्रिटिक बट ऑब्वियसली लाइक जनरली एज वेल, आपने सबसे पहले तारीफ करनी है. यू आर गोइंग टू टॉक अबाउट द पॉजिटिव कंट्रीब्यूशंस, देन यू आर गोइंग टू मेंशन ऑल ऑफ द बैड थिंग्स, एंड देन यू आर गोइंग टू एंड अगेन विद ए पॉजिटिव comment, ठीक है. तो make sure that you apply that in a critique as well. You have to be very nice regardless of how stupid the article is, and you have to be very professional. Okay, so now the body. As I mentioned before, this is the largest part of the LTE, ठीक है. For a general letter or opinion, start with mentioning points supporting your claim or topic in a convincing tone, ठीक है. Again, this is the place where you start talking in detail about whatever you're writing on. So, for example, if you're writing on a drug, you're going to talk a bit more about the results of whatever recently published RCT you found. You're going to talk about previously conducted research on the same drug, if there is any. Usually, since we are becoming doctors, we only talk about human research. But if you know, if there's a drug जिसका पहला अभी human trial हुआ, you can maybe talk about animal studies as well, कि if there's, you know, अगर कोई response आता भी है उस drug से या नहीं, right? And then include references. Obviously, we've talked about that. I've stressed on this a lot. Whatever you write, कोई एक भी चीज लिख रहे हैं, you need to cite a reference. That is very, very important. Reference के बगैर कोई चीज आप लिख ही नहीं सकते. आपने कहा है ना मेरा नाम ईमान है, you need to add a reference for it. ठीक है. Statistical data is preferred as qualitative studies are not as valuable as quantitative. Obviously, this can vary as well according to the specialty that you are writing about. Psychiatry में, for example, quantitative studies are very important. Psychiatry, psychology वगैरह में. But you should mention some statistical data from the article that you're writing. ठीक है. Then a conclusion. So these are actually very good questions, you know, just say how would this be implemented? Why is this relevant? How will it help healthcare professionals or the medical community? ये जो तीन questions है ना, if you write the answers to these questions in your conclusion, that's a perfect conclusion. ठीक है? I would advise you guys to note these down because this is, you know, this is like a very good guide. So आपने बस यही लिखना होता है conclusion में, ये implement कैसे होगा? इसको इसके साथ हम कर क्या सकते हैं, ठीक है, इसकी जरूरत क्यों है, why is this relevant in today's day and age, you know, is there a new problem that needs to be addressed जिसके लिए हम ये development कर रहे हैं, ठीक है, how will it help healthcare professionals or the medical community, is it providing a new option, is it providing, you know, like I talked about compliance, is it going to increase increase and improve patient compliance, is it sorry. Okay, sorry about that. Is it going to provide a new option for treatment? ठीक है, तो there are a lot of questions that you can answer, लेकिन ये जो तीन questions है ना, अगर आप इनको answer करते हैं in the conclusion, then that is going to be the perfect conclusion. And again, it's only 50 to 100 words. And the number of words that we've told you, this is just a guide कि आप इतने इतने रख लें, इससे ऊपर नीचे हो सकता है, ठीक है, कोई इसमें मसला नहीं है. एंड आप जिस जर्नल के लिए लिख रहे हैं उसकी आपने ऑथर गाइडलाइंस जरूरी देखनी है, ठीक है. You have to conform to the author guidelines, otherwise they will just reject your paper. This sandwich method जो मैंने already discuss कर लिया है, if you politely state the qualities of a study or paper in the initial phase of your body or in the introduction, आप I would advise कि आप introduction में लिखते हैं, you know, like start with dear editor sorry, dear editor, Abdullah Suhail et al. Have, you know, conducted a very good research और ये कर दिया इन्होंने, वो कर दिया, बहुत जरूरी है, बहुत अच्छा काम किया, ठीक है, ये इंट्रो में लिखें और फिर इंट्रो को इस तरह एंड करें. However, we have some concerns that we would like to address in this letter, ठीक है, and then start talking about whatever problems you identified in their research project. Okay, so we're taking a 3-minute break and then we'll resume at 8 p.m. Suggests it is criticism on a previously published article, whereas in normal LTE जिसको मैं कह रही हूँ वो ये होता है कि आप जिस तरह से, you know, you might have read letters to the editor in newspapers for example, ठीक है, आज से आपने जाके newspapers में भी LTEs देखने के वो किस तरह से होते हैं, वो होता क्या है कि कोई एक जनरल इंटरेस्ट का टॉपिक होता है जिसके बारे में जनरली एक आर्टिकल लिखा होता है, ठीक है, आर्टिकल भी नहीं होता, it's a very small um, it's a very small summary of whatever the problem is, right? So do make sure that you know the difference between a critique and a normal LT, because the process of writing both of them is a bit different, all right? Ansin Ahmed, you can just start now. Ahmed, you can start now.
Okay. Assalamu alaikum, guys. My name is Ahmed Kesser, and I'm a student of first year MBBS. Just let me know if everyone can hear me fine so I can share my screen and resume cover my portion of the workshop. Just let me know in the
Yes,
chat.
Ahmed.
Okay, perfect. I'm just gonna share my screen right now. Can everybody see the screen?
Yes, we can.
Okay. So the way this is going to go is that I'm first going to give you a brief overview of what referencing is, and then I'll go over what citations are, explain the key differences between the two because they're not synonymous. And a lot of people make this mistake at the start of their research journeys is to confuse the two. So it is very important to focus right now because you need to differentiate between the two when you're writing any sort of research article. And then I'll go over the reference style that you have to do, like that you will use for the letter or any other research article that you're doing. And then I'll go over the details that I need you to make note of for when you're referencing. Okay, so let's start. Now, what are references? References are, like in simple words, just acknowledgements of other academic works or sources that you have used in your letter. Okay, regardless of where in the letter you have made a point that you have taken from some other research, you will have to reference it. Okay, and the reference list that is found at the end of the article. So if you were to pull up any article on PubMed or just like on Google Scholar even, you would find okay, at the end of the article, there is a list like that resembles the one shown in the picture. Okay, this is the reference list. And for the letter, there is a maximum number of references that you have to take note of. And this varies from journal to journal. Like for example, JPMA ka jo maximum number hai, that is 5. So it really depends. So I would suggest okay, to find out the maximum number of references, you need to go to the journal's website and just clarify this piece of information. Because when you're writing your LD, it is very important like note this information from the start ताकि you write accordingly. Otherwise, at the end, references को manage करना, it becomes difficult. So right now, just remember that references are found at the end of the article, and these are what like you do, like what you include, acknowledge another person's work that you have basically used in your own letter. As for citations, these are the brief notations that you make within the text of the paper or the article. Now, these will point to the source from which the information, the data, or the ideas are taken from. So in the picture on the slide, you can see that there is this number in superscript. Now, that is a citation. That can either look like this, like in a superscript, or it can like be in a bracket. Basically, what the citation does is that it indicates to the reader or the like the reviewer okay, this point is taken from the third reference that is found at the end of the document in the reference list. So like, for example, इस picture में जो 3 number है in the superscript, that is indicating कि जो reference list में जो third reference है, that is where this information has been taken from. Now, this was the basic like difference between references and citations. Now, before I do give like the overview of what reference style you are supposed to use, I want to explain like why you should actually reference. And there's the obvious reasons why you should do it, but there are also the practical reasons which you should be concerned about. The obvious reasons include like building credibility and authority because देखो, like when you make a point throughout your letter, whether that be in your introduction, your body, or your conclusion, you can't just expect the reader or the reviewer to just accept your point or just trust what you're saying. You have to like matlab, have some evidence to back you, and that's where the reference comes in, right? Secondly, it obviously provides evidence, like I said. And lastly, it acknowledges another person's work because you can't really take another person's data, figures, stats, or any other kind of information and just include it without actually acknowledging that piece of information. These are the obvious reasons why you should do it. Lekin, there are some practical reasons which I think people should be like focusing on because like these are the reasons why you should basically not overlook referencing. You do referencing to avoid 3 things: plagiarism, loss of credibility, and the idea and claim it as your own. Now, like on like in theory, that doesn't sound like a huge thing. Lekin, if a journal were to accept your letter and publish it, and later they find out that you haven't referenced properly, some journals won't do the task of letting you know and like asking you to revise your manuscript. They will just retract your article, and that will be very damaging for your research profile. So you need to avoid all these things. Then there's loss of credibility, both for you and the journal, and this is very damaging as well. And like I mentioned, retractions and delays, these are like this is the most dangerous thing that you need to avoid about your research journey, and to avoid it. One of the things you should do is to reference properly.
All right, so we'll continue where we left off. Just a second. So we were talking about why we need to add references, right? And why we need to add citations. I hope my screen is visible to everyone, and I hope I am audible. Okay,
Yes, you
so
are.
thank you, Noor. Okay, so the first reason is obviously to avoid plagiarism, because if you add a sentence, a single sentence, or even a few words from an article that you haven't cited properly, so that counts it as plagiarism. वैसे भी जब आपने कुछ content डालना होता है, you have to rephrase it. आप उठा के सीधा नहीं डाल सकते, ठीक है? Referencing या cite करने का ये मतलब नहीं होता that you can just copy paste sentences into your own article. That will still count as plagiarism. अगर आप उसको cite कर भी देना, अगर आप बता भी दें कि मैंने ये यहाँ से लिया, that's still plagiarism, right? You need to make sure that you're paraphrasing and changing the content of that particular sentence, right? Content तो नहीं, but like जो जिस तरह से वो लिखा हुआ है उसको आपने paraphrase करना है. A technique that I use is को active form में लिखा हुआ है तो मैं उसको passively लिख देती हूँ, ठीक है? Loss of credibility avoid करने के लिए, right? You need to make sure that you are citing good research, you are citing properly conducted studies, ठीक है? For example, अगर मैं कोई ऐसी study cite कर दूँ जो कि किसी पाकिस्तान में कहीं पे हुई है, like sorry to say, but generally obviously like Pakistan की studies are not taken to be as credible. लेकिन उसकी credibility किस तरह से improve हो सकती है अगर कोई पाकिस्तान में study conduct हुई है, properly उन्होंने protocol follow किया है, ठीक है, they registered it with the trial registry of Pakistan, ठीक है? ये सारी चीजें अगर उनके मेथड सेक्शन में लिखी हुई, that means that it is a very credible study, even if it's in Pakistan, ठीक है, or anywhere else in the world. But you just need to make sure that the methods are robust, ठीक है, उसमें बताया हो कि हमने क्या क्या किया था इस स्टडी में, ठीक है, and that will increase the credibility of your study, ठीक है? उसके बाद to avoid retractions and delays इसीलिए होते हैं जब आपका आर्टिकल डेस्क रिजेक्ट हो जाता है, एंड योर आर्टिकल विल गेट डेस्क रिजेक्टेड इफ यू हैवंट इंक्लूड क्रेडिबल और एनी रेफरेंसेस, ठीक है? As I said पहले भी you need to cite, you need to give a reference for every single thing that you're mentioning. If you're saying my name is Eeman, you need to add a reference, ठीक है? If you don't add that, the editor is going to see your article and they're going to be like ये क्या लिखा हुआ है? I'm not going to accept this. I'm not going to send it to I'm not going to send it off for peer review. And that's going to cause unnecessary details in publishing your article. Okay? So in order to avoid that, you need to add references and you need to cite each and everything that you mentioned. And then again, to avoid rejection, अगर कोई ऐसा editor है भी जिसको पता नहीं चला, or like उन्होंने इतना ध्यान नहीं दिया and they've sent it off for peer review, it's going to get rejected बाद में. ठीक है? Okay, so this is a brief comparison of the differences between references and citations. ठीक है? Obviously we've talked about it कि references होते क्या हैं, citations होते क्या हैं. So the references, एक जो list होती है ना at the end of an article, that is what is called a reference. ठीक है? And a citation is जो in text citation आपने की होती है, जो numbers लिखे होते हैं, जो अहमद ने point out किया था कि ये this is a citation and these are all references. ठीक है? And then again, the format can vary. There are different referencing styles. If you've done 4th year or if you are currently in 4th year MBBS, you would know what different kind of referencing styles are. ठीक है? And that again depends on the journal's requirement. The journal tells you कि हमें किस referencing style में चाहिए, और अगर आप वो follow नहीं करेंगे, again they will just send it back. They will not look at the article. They will not send it off for peer review until and unless you make that, unless you fix that. ठीक है? And then frequency, yes, a very important point, that each source is listed once. Even if you are citing the same article 2 to 3 times in your LTE or in your article, you are going to write the reference only once. ठीक है? आपने नंबर 1 साइट कर दिया, फिर आपने 2 साइट किया, फिर 3 साइट किया, फिर जो आपने 1 पे साइट किया था आपने वहां से इंफॉर्मेशन दोबारा साइट की है. ठीक है? You're not going to write 4 here, you're going to write 1 again. ठीक है? You can't write or you can't mention the same articles again and again in the referencing list, in the references list. ठीक है? Again, citations are appear within the body and they are usually numbers. ठीक है? वो superscripts में होते हैं, brackets में होते हैं, different kinds of brackets में भी हो सकते हैं, square brackets and round brackets में भी होते हैं. And ये आप लोग if you look at any published articles, you would see कि किस तरह से ये mention हुए होते हैं. ठीक है? So one of the referencing styles and the most popular one is the Vancouver style. ठीक है? इसमें ये इन्होंने मेंशन किया हुआ है कि ऑथर्स की लिस्ट होती है, सो इट्स द सरनेम ऑफ द ऑथर. ठीक है? फॉलोड बाय the initials of like the first name and the middle name. Just say there should have been a space here, but this is the perfect example. So this is the surname of the author, this is the first initial, and this is the initial of the middle name. Okay? And then there is the title of the article and there is the abbreviated journal name. Okay? So यहाँ पे पूरा नहीं लिखा होता है, यहाँ पे सिर्फ एक abbreviation होती है. एंड वैंकूवर स्टाइल अगर आप पबमेट में भी जाए ना, सो पबमेट पे एक ऑप्शन होती है साइट करने की. ठीक है? वहाँ पे भी it allows you to look at different referencing styles. So I would advise you to do that and just take a look at how different styles vary. ठीक है? And you can also do that by downloading a referencing manager. For example, you can try Zotero, for example, that's free. And it's very easy to use, so I would advise you to do that. Again, Vancouver mein usually you mention the citation in brackets, in square brackets. Okay? Okay, so this is the abbreviated journal name. I personally don't think that you should do it manually. Okay? You should have a referencing manager to do this. Because it becomes very cumbersome. एक तो आपको individually सारे वो देखने पड़ते हैं. अच्छा, this is the cite action button that I was talking about. यहाँ पे आप click करते हैं, so it gives you the different kinds of citations. ठीक है? One thing that I will do is I think I can go through the website with you guys ताकि आपको पता भी चल जाए कि किस तरह से ये चलता है. Just give me a minute. I'll open PubMed for you right now. I hope my screen is visible to everyone. So we'll search SGLT2 inhibitors here. ठीक है, ये मुझे एक आर्टिकल मिल गया। अब इसमें this is the abbreviated journal name, ठीक है। and यहाँ पे जब मैं site click करती हूँ, this is going to give me an option to look at different referencing styles और उनके किस तरह से appear होते हैं, references किस तरह से appear होते हैं। NLM is another form of Vancouver, like आप Vancouver and NLM एक ही बात है, just to make it simple, ठीक है। इसमें as we talked पहले last name आते हैं, उसके बाद initials आते हैं, और अगर एक कोई middle name भी है तो वो साथ ही आ जाएगा as an initial, ठीक है। उसके बाद पूरा title है of the article, and then there is the abbreviated journal name. और इसी तरह if I look at a different format, तो उसमें there obviously change हो गया, right? As you can see, the article in the MLA format, the article title is within quotation marks, and the journal name is not abbreviated, and आगे भी differences होती हैं. So for example, यहाँ पे they've mentioned कि publish कब हुआ था, right? But यहाँ पे उस तरह से it's not mentioned. सिर्फ ये mention हुआ है कि journal के like ये journal का है कि कौन सा issue था, right? So volume 83. So I hope this makes sense. We'll go back to the presentation now. Okay. Okay, so as we've talked several times now, journals have specific guidelines on how they want their references to look. So, for example, ये JPMA की guidelines attached हुई हुई हैं. They request Vancouver style referencing. And one thing that I would mention again is if you don't follow their guidelines, they will reject your paper, and again, it's going to cause unnecessary details. Okay, so it's very important that you look at the author guidelines before you submit. और LTS के लिए तो I usually recommend कि आप journal देख लो पहले, लिखने से पहले देख लो, and then उसको update करो, ठीक है, then उसको लिखो. Okay, so I think that is it for the presentation. And next up, we have Ans, who's going to take over now. If you guys want a 2 to 3 minute break, we can do that. And right now, I will take any questions that you guys might have. You guys can unmute yourselves if you want, or you guys can send in your questions in the chat, and I'll be happy to answer them before Ans takes over. Okay, so Ishil has mentioned, can we copy it from the site option given there and paste it on our paper? So I used to do that. मैं सिर्फ यही करती थी, ठीक है? लेकिन recently I've realized कि this is a very bad option क्योंकि this is what I meant when I said कि don't do it manually. Manually करने का मतलब ये होता है कि आप वहाँ से site वाले option से ले रहे हो और अपने references list में डाल रहे हो. Starting में आप कर लो, ठीक है, and for NTs it's very easy to manage, but obviously when you're writing full length articles and you're collaborating with a lot of people and you have to combine everyone's references, 40-50 references हो वो आपने combine करने हैं तो वो बहुत ज़्यादा मसला होता है, पर ठीक है. So for that reason I would advise you to download a referencing manager. Zotero का मैंने आप लोगों को बताया है, मैं इधर लिख भी देती हूँ spellings. Zotero. Do make sure that you try to use it, ठीक है. इसकी plugin होता है for Word, वो साथ ही download हो जाता है. When you download Zotero and you open Word after downloading it, तो वो automatically appear हो जाएगा उसमें option cite करने के लिए and everything, ठीक है. So use Zotero to okay, thank you, Ans, to manage your references, and don't do it manually, ठीक है. And as Noor has said, yes, don't get overwhelmed by referencing. अगर आप manually उसको करने की कोशिश करेंगे तो वो you will get overwhelmed. And वैसे भी, you know, like I know that we went through this actual style of the referencing, जैसे मैंने आप लोगों को बताया कि abbreviated journal name होता है, ये होता है, वो होता है. तो मे बी यूर थिंकिंग कि क्या जरूरत है, फिर अगर ऑटोमेटिकली सब होना है तो हमें इसका पता होने की क्या जरूरत है. ऑब्वियसली पता होने की जरूरत है, बिकॉज इवन इफ इट्स बीइंग डन ऑटोमेटिकली यू नीड टू बी एबल टू recognize the different referencing styles to ensure that you use the correct one according to the journal requirements, and to also ensure that, you know, when you're collaborating with someone else, whether or not they follow the correct referencing style or not. Because when you start collaborating with people, you will realize how inefficient some people can be, obviously, or maybe on purpose nahi bhi hota, maybe they're just beginners and they make mistakes. We need to be able to identify those mistakes, right? So that's why it's important to ensure that you know the different referencing style hote kaise hain, theek hai. And if we don't have any questions right now, I will take questions after Ans is done with this part. So Ans, you can start now.
Okay, so Assalamu alaikum. Am I audible?
Yes, you are.
Okay, so Assalamu alaikum everyone. My name is Mohammad Ans and I'm a first year medical student at FMH. The part of this workshop that I'm going to be covering is how to look for a topic when it comes to a generalized form of LT. So I'm going to discuss different approaches that you can use. These approaches have been used by my seniors and also a lot of mentors in the past, and people have attained a lot of publications by using these approaches. So I have basically compiled, I have cherry-picked everything for you and I have compiled it, and I'm going to discuss it one by one with you. The first one being type latest FDA approvals or FDA withdrawals or disease outbreak in the news section of Google. It is literally the easiest approach that you can use. आप Google पर जाओ, सर्च बार में न्यू एफडीए अप्रूवल या फिर न्यू एफडीए विड्रॉल या फिर डिजीज आउटब्रेक लिखो और न्यूज सेक्शन के अंदर आपको टन्स ऑफ हेडलाइंस मिलेंगी. एंड दीज हेडलाइंस यू विल फाइंड लाइक stuff that was uploaded 2 hours ago, 2 days ago, basically stuff that is recent. Because when it comes to LTs, आपने वो चीज़ उस पर काम करना होता है, उस पर आपने आर्टिकल लिखना होता है जो कि बहुत इम्पैक्टफुल हो और जो कि रीसेंट हो. यू कांट पिक अप समथिंग विच वाज डन अ ईयर अगो और 2 years ago and then talk about it right now, क्योंकि वो तो ऑलरेडी लाइक नजर आम में आ चुका होगा टॉपिक. एंड इट्स नॉट गोना बी दैट लाइक एक हेडलाइन नहीं वो होगी. However, if there was an intervention that surfaced a year ago, but now उसके और भी benefits आ रहे हैं surface पर, तो फिर आप उस पर लिख सकते हैं. And as for like the withdrawals part, FDA अक्सर approve कर देता है कुछ medications and interventions. However, later on, when they reevaluate it, and so sometimes they withdraw their approval. उस केस में you can call for an alarm, ठीक है, और इस तरह से आप headline लिख कर अपनी title LT का title लिख करके call for an alarm, FDA withdrawal, um, FDA has withdrawn its approval for this drug or this specific intervention, then you can write an LT on that, ठीक है, asking physicians to be vigilant about it. The second approach that you can use is going for Medscape. It's honestly a gem, ठीक है. You have to just type Medscape, उनकी आपने website खोलनी है, and this is the page that will open up. और नीचे latest news लिखी होगी और like बहुत ज़्यादा headlines आपको मिलेंगी इस तरह से, like articles आपको मिलेंगे. And the best thing about Medscape is that it is something that is run by people who are experienced. So basically whatever you will find here, ठीक है, you can rely on that information. लेकिन it's important कि आप बाद में उस पर research करो, आप उसके पर literature search करो, and आप अपना भी एक analysis run करो on PubMed. एंड लाइक इसके अंदर एक और भी एक स्पेशल चीज़ है कि यू कैन एक्चुअली चूज द स्पेशलिटी ऑफ इंटरेस्ट व्हेन इट कम्स टू लुकिंग फॉर समथिंग। लाइक आप इसको क्लिक करेंगे और यहाँ पर एलर्जी एंड इम्यूनोलॉजी, एनेस्थीसियोलॉजी, कार्डियोलॉजी, क्रिटिकल केयर, डर्मेटोलॉजी खुलेगा, और जब आप इनको क्लिक करोगे तो उससे स्पेसिफिक आपके पास हेडलाइंस आ जाएंगी। दीज हेडलाइंस माइट इंक्लूड लेटेस्ट ब्रेक थ्रूज इन मेडिसिन, या फिर कोई नई पॉलिसीज रिलीज हुई हो, कोई नए आउटब्रेक्स, कुछ भी हो सकता है, नई कोई सर्जिकल इंटरवेंशन आ गई हो, तो you can write an LT on that. The third approach that you can use, and I guess everyone knows this, everyone stocks accounts. तो आप Instagram को use कर सकते हैं, LinkedIn को भी use कर सकते हैं. The way to use Instagram is to go for specific pages जो कि इसी काम के लिए ना like dedicated होते हैं. For example, there is making sense of science. इसके अंदर they usually upload everything that is impactful, or you can then look it up later on. There are news channels such as Guardian, वहाँ पर भी ऑफनली इस तरह की आ जाती हैं, ठीक है, कोई भी न्यूज़ आ जाती है रिगार्डिंग समथिंग इम्पैक्टफुल इन द हेल्थ केयर सिस्टम, जो कि अभी नया इंटरवेंशन आया हो या फिर एनी डिस्कवरी, ठीक है। The second thing, and it is crucial, is LinkedIn, ठीक है। Build connections and stock IMGs. Like I can't stress enough on this. आपको like आपने अपने आप को compare करना है with non-US IMGs, because that's the trajectory that you are going to follow, and you will find tons of them on LinkedIn. Yes, जैसे कि ईमान ने शुरू में chat box में कहा था, you need to be vigilant when it comes to LinkedIn. आपने हर किसी पर trust नहीं करना, आपने आगे जाके अपना like critical thinking involve करनी है और research करनी है whether if this information, this piece of information was true or was it faulty, ठीक है। And keep an eye on what people are working on, what they are publishing. वहाँ पर अक्सर लोग ना अपनी achievements upload करते हैं। It's a professional website जहाँ पर आप इंटरेक्ट करते हो लोगों से, आप काम लेते हो और काम देते भी हो। पीपल अपलोड देयर अचीवमेंट्स। अगर किसी ने लाइक अपलोड किया है कि आई पब्लिश्ड माई LT इन फ्ला फ्ला जर्नल ऑन अ फ्ला फ्ला टॉपिक, तो लाइक स्टॉक दैट, ठीक है, यू शुड डू दैट, क्योंकि अगर उसने वहां पर LT पब्लिश किया है तो देयर इज अ हाई चांस दैट दैट जर्नल इज LT फ्रेंडली एज वेल। वो LTs एक्सेप्ट करते हैं। कुछ जर्नल्स तो आजकल लाइक सीधा रिजेक्ट कर देते हैं LTs, बिकॉज स्पेस ही नहीं होती किसी के पास। तो यू हैव टू लाइक कीप दैट इन योर माइंड, एंड आपने स्टॉक करना है। उसके बाद आपने उस जर्नल की गाइडलाइंस देखनी है, उस जर्नल के अंदर डिफरेंट LTs देखने, उनके फॉर्मेट्स देखने, एंड अकॉर्डिंगली प्लान योर एंटायर journey behind writing an LT. The topic that you are going to select वो उसी journal से specific होना चाहिए। और इसके अलावा LinkedIn can also help you understand which specific specialties or which topics are like in vogue right now, in fashion right now. Like हर topic का fashion चलता है। For example, अभी recently semaglutide The fourth approach that you can use is read up top and recent articles of reputable journals. For example, Lancet, JAMA, Nature, and etc. So usually this approach comes really handy when you are conducting a meta-analysis or when you're looking for a topic for systematic reviews. However, because these journals they have such high impact factor, तो usually इनके prerequisites और इनकी like criteria वो बहुत high होते हैं, इनके standards बहुत high होते हैं. If something is getting accepted here, know that that article is really impactful. जो उन्होंने point raise किया है, जो उन्होंने stats दिए हैं, जो facts दिए हैं, they are really impactful, ठीक है। तो वहाँ पर आप clinical trials ढूंढो, कोई भी नई discovery ढूंढो. You have to, look up, for example, if anyone has watched Enola Holmes, उसके अंदर Sherlock Holmes कहता है कि everything is just there. You need to be observant, ठीक है, and you need to be vigilant about stuff. आपको कुछ चीज दिखेगी, look it up, ठीक है. It might lead to a publication because that topic might be impactful. Now, how to test the viability of a topic? First of all, you need to ensure that there is no already published letter to the editor on that topic. This is crucial because obviously किसने already किया है उस पर काम तो आप करेंगे तो, but new are you contributing to the existing scientific literature? And the second thing is make sure that there is enough literature on PubMed to support your topic. Third one is original studies add more weightage when it comes to referencing. ये ईमान ने भी बात की है, ये अब्दुल्ला ने भी बात की है, and ये मैं भी कर रहा हूँ. Like I can't stress enough on this. Please don't reference case reports, LT, other LTs, or just narrative reviews. Always try to look for original studies such as meta-analysis, RCTs, cohort studies, इस तरह से कुछ ढूंढो, ठीक है? And most importantly, get a mentor's opinion. And you can find mentors on LinkedIn, ठीक है? People are there to help you, ठीक है? बहुत से लोग आपको help करेंगे. And that is it from my side. Now we are going to discuss a sample LT. Iman, should we go for that? Or should we take a small break to address any query?
Hello, Ans, am I audible?
Yes, you are audible.
Ans, you can go forward with that later.
Okay. Okay, so now my colleague Ahmed and I are going to read this LT with you guys. ये एक generalized form of LT है. जैसे कि आपको हम पिछली examples दे रहे थे कि आपको कोई नया intervention दिखता है तो आप उसके बारे में बात कर सकते हो. ये उसकी एक example है. It's basic. We are going to read it with you. और हम and I need to make something really clear. It's not necessary for you guys to understand everything that is written here. However, जो भी points मैं बोलूँगा या फिर जो भी points अहमद आके बोलेगा, you have to make mental notes of that, ठीक है? Take a piece of paper और notes बना लें या फिर keep those points in your mind because those things are crucial, ठीक है? So now, let's start with the title, Integrating Traditional Chinese Medicine and Artificial Intelligence for Insomnia, A Promising Frontier. So जो आपका LTE का टाइटल होता है ना, it is really important. काफी लोग इस चीज पर स्ट्रेस नहीं देते. They just ask ChatGPT to create a title for them. You can do that, लेकिन please add your own creativity to it as well. Your title should not be monotonous, ज़्यादा lengthy ना हो और vague ना हो और it should be something easily understandable. ठीक है? अब मैंने पढ़ा and I know what this IELTS is going to be about. ठीक है? They're going to integrate traditional Chinese medicine and artificial intelligence for insomnia. ठीक है? So let's scroll down. Sorry for that. Now, as Abdullah's slides covered the basic format of an LT, सबसे पहले आएगा introduction. It's usually the first paragraph. जो भी first paragraph होगा वो introduction होगा. जो भी last paragraph होगा, usually that's the conclusion. And every LT starts with Dear Editor because LT is basically a letter. So you are sending a letter to the editor of that journal. So it's going to start with Dear Editor. Now, I'm going to highlight the stuff जो कि मैं discuss करूँगा and you guys need to make mental notes of everything that I will talk about. The first thing that the author has brought to our attention is what insomnia is. That is usually how you start your introduction. आपका जो complication है, जो disease है, जो मसला है ना, आपने उसको पहले define करना है. उसकी prevalence को बताना है, वो मसला है क्या, how is it affecting people, उसके लिए past जो उसके like of dealing with that treatment, dealing with that disease, dealing with that complication थे ना जो conventional standard methods से आपने वो बताना है आपने बताना है कि why were those methods lacking ठीक है या फिर why am I recommending this new intervention for that ठीक है or maybe this intervention that was old and now after coupling it with something new maybe it can result in better outcomes ठीक है so you have to talk about that in the introduction जैसे कि the author has mentioned insomnia is a widespread condition that severely affects individuals' health, disrupting their work and daily lives. उसने insomnia का बताया कि it's something global, a global issue है, and how it impacts the quality of life of people. That about while pharmacological treatments for insomnia provide quick relief, they often come with significant adverse reactions. उसने अपने आपको बताया कि जो standard treatments है ना इस चीज के वो एडवर्स रिएक्शंस कॉज करते हैं एडवर्स रिएक्शंस बेसिकली जो बैड साइड इफेक्ट्स होते हैं ना वो होते हैं नाउ ही इज गोइंग टू लाइक स्टेट हिज पर्पस फॉर द एलटी ठीक है वो अब वो करेंगे डिस्कस TCM offers a range of non-drug therapies that have been used for centuries to treat insomnia. This is crucial, ठीक है आपने ये चीज दिमाग में रखनी है कि whenever you are writing an LT तो आपने developed statements लिखनी है ठीक है because you already have a really small word limit and आपने लाइक बॉडी में भी काफी ज्यादा invest करना करना है तो मेक श्योर कि आप ना यूज हैं जो कि ना एडिटर पढ़ते हुए कहे कि ओके यू नो दिस थिंग इज वर्थ अ रीड, हैव बीन यूज्ड फॉर सेंचुरीज। ओके ठीक है, इस बात पर जरा हाईलाइट करें आप लोग, इट हैज बीन यूज्ड फॉर सेंचुरीज। ओके ठीक है, मतलब कि दिस थिंग वाज वेल डॉक्यूमेंटेड, एक इसकी पुरानी लाइक हिस्ट्री है ऑफ एप्लीकेशन ऑन पेशेंट, सो इट वाज सेफ। ठीक है, however, the diversity in methods and their varying efficacy calls for a systematic evaluation. This letter explores the potential of integrating TCM with artificial intelligence to enhance the treatment of insomnia. पर्पस सारा मेंशन हो गया, अब मुझे पता है कि मुझे आगे क्या लाइक एनकाउंटर करना पड़ेगा इस लेटर में, एंड आई एम एंगेज्ड बिकॉज उसने इतने लाइक डेवलप स्टेटमेंट्स में ना अपना पॉइंट कन्वे किया। नाउ जो बॉडी है ना, इट यूजली स्टार्ट्स फ्रॉम द सेकंड पैराग्राफ, उसके अंदर जो आपका इंटरवेंशन है ना, यू हैव टू फर्स्टली इलेबोरेट ऑन इट अ लिटिल बिट, फर्दर डिफाइन इट, उसके अंदर अगर कोई कैटेगरीज हैं, आगे फर्दर डिविजन्स हैं, वो आपने बतानी, कोई एग्जांपल्स हैं वो देनी है उस ड्रग की, अगर तो क्लास है तो ऑब्वियसली गिव द पॉपुलर ड्रग्स की एग्जांपल्स, अगर तो सीधा एक ही ड्रग है तो यू डोंट नीड टू गिव एग्जांपल्स, जैसे कि इन्होंने यहाँ पर किया कि TCM अप्रोचेस टू इंसोम्निया इन्वॉल्व हर्बल मेडिसिन, एक्यूपंक्चर, एक्यूप्रेशर एंड लाइफस्टाइल modifications aiming to balance the body's energy and restore harmony between mind and body. Common TCM herbs for insomnia include Swan-Zao-Ren, Bai-Zi-Ren, and He-Hom-Pi. These interventions have been known to improve sleep quality and reduce insomnia symptoms. उसने अब पॉइंट रेस किया, उसने बताया कि लाइक जैसे कि मैंने पहले कहा था कि वेल डॉक्यूमेंटेड है, क्यों है वेल डॉक्यूमेंटेड, क्योंकि प्रूफ है कि इट हैज शोन एफिकेसी। नाउ ये जो पॉइंट है ये बहुत दफा हमने रेस किया है, एंड आई पर्सनली बिलीव दैट दिस स्पेसिफिक पैराग्राफ जो कि मैं अब पढ़ने लगूँ ना, इट वाज something that opened the eyes of the editor, it inclined him towards this letter to editor, and it made him accept this letter to editor, aside from the fact that it's really well structured, it's really coherent. उसने कहा है a recent meta analysis control trials to investigate the efficacy of TCM non-drug therapies for primary insomnia has revealed significant information. The review included 16 articles with a total of 1,285 patients. The results demonstrated that TCM non-drug therapy significantly improved the treatment response. यहाँ पर उसने स्टैट मेंशन कर दिया। नाउ व्हाई वाज दिस सिग्निफिकेंट? एक तो मेटा एनालिसिस है, ठीक है। Secondly, it's a meta-analysis of randomized control trials जो कि 16 आर्टिकल्स थे, और उनके अंदर जो पेशेंट्स की टोटल लाइक पूल है ना वो 1,285 है, ठीक है। दिस इज enough proof to actually consider giving this medication to someone. और बाद में उन्होंने एक स्टैट भी मेंशन कर दिया उस मेटा एनालिसिस का, ORU like it's not a requirement for you to understand it right now, like abhi is level par nahi, but just to give you a disclaimer, OR tells you how significant your intervention was for that specific outcome. Agar OR 1 se zyada hai to it was significant, baki 95% confidence interval hai, aur jo range hai na, it further gives you an idea of how significant the results were. Reduced post-treatment Pittsburgh sleep quality index scores, उसका भी बाद में उसने मीन डिफरेंस दिया हुआ है, and improved anxiety and depression levels. Okay, so he has statistically proven his points, ठीक है, and अब now as a reviewer, as a reader even, ठीक है, I'm inclined to like learning more about it. Even as a physician, मैं कहूंगा कि ओके भाई ये कुछ लाइक इसमें दम है इस बात में, मैं आगे पढ़ूंगा, ठीक है। नाउ ही इज गोइंग टू टॉक अबाउट द सेकंड पार्ट ऑफ हिज इंटरवेंशन जो कि आर्टिफिशियल इंटेलिजेंस है, ठीक है। फर्स्टली ही विल डिफाइन दैट, जैसे उसने पहले किया था यहाँ पर, इसी तरह अब वो AI को पहले डिफाइन करेगा, बाद में ना वो बॉडी में ना उसको फर्दर इलेबोरेट करेगा उसी की बॉडी में, एंड ही विल लाइक बैक इट अप विद रेफरेंसिंग, ठीक है। AI has rapidly advanced, providing powerful tools for data analysis, pattern recognition, and predictive modeling. In healthcare, AI enhances the diagnosis, treatment, and management of various conditions, including insomnia. Machine learning algorithms can analyze large data sets to identify patterns and predict outcomes with high accuracy. सो आप लोगों को एक चीज नोटिस नहीं हुई कि हाउ स्मार्टली दिस गाय हैज रिलेटेड ट्रेडिशनल चाइनीज मेडिसिन विद एआई? लाइक हु कुड हैव थॉट ऑफ दैट? इस तरह के लोगों को ना लोग एडिटर्स और जर्नल्स ढूंढते हैं, वो इस तरह की रिसर्च चाहते हैं, वो इस तरह के एलटीज चाहते हैं, ठीक है। एआई भी क्योंकि अभी रिसेंटली बहुत लाइक फैशन में है एक तो, और लाइक उसने इसका इस चीज के साथ लिंक जैसे क्रिएट किया ना। You will learn about this later in the next part of the body, which my colleague Ahmad is going to cover. So, Ahmad, I would like to invite you to cover the next part of the body. Thank you so much, everyone.
Noor, if you can just make Ahmed the co-host, he'll can continue with the letter. He'll just wind it
Okay,
up and then
it's
we can move
done.
forward.
It's done.
Okay,
I'm
okay.
sharing the screen now. Okay, I'm going to quickly wrap up this letter and just resume from this part of the body. As Ans was already telling you, there is a in this letter, and I'm going to read the AI's current applications in insomnia treatment primarily involve data-driven methods for tailoring treatment regimens. In this part of the letter, what the author is doing is that they're now expanding on what they said previously, कि AI की कितनी applications हैं in this field. They talked about TCM, right? And they talked about its extensive use previously throughout history. And then they expanded on how AI can be used. If you can notice, abhi tak, there hasn't been any like kind of like there is an order of ideas. There is no jumping, haphazard jumping from one idea to another. There is a flow, and the authors have made sure to maintain this throughout the letter. I'm not going to go over this entire paragraph because it's lengthy and it's not important for you to understand what it is saying. Like, basically, what I need you to understand is that there is a flow of ideas. First, the author talked about the importance of TCM. Then they talked about how AI can be integrated with TCM. And specifically in this part, I want you to look at this figure that the authors have chosen to include. Now, this is not a necessity because letters are short research articles. So is तरह के figures are not necessary, not a requirement. Lekin because this is a conceptual topic, they have chosen to do it. And they have chosen to do it just to clarify and clear the topic for the readers. And something like this is not necessary, like I said before, lekin it just adds, more to the letter. आगे जाके, I'm just gonna go over the conclusion now. The integration of TCM and AI represents a novel and promising approach to managing insomnia. By harnessing the strengths of both traditional practices and modern technology, it is possible to develop more effective, personalized, and adaptive treatments. At this point, what the author is doing is that they're summarizing the gist of what they mentioned in the previous paragraphs. And what they want to do is that they have to leave the reader with a take-home message that they think about. To focus on this part, current research highlights the potential benefits of this combined approach, though further studies and clinical trials are essential to fully understand and validate its efficacy. As the field evolves, we can expect more innovative solutions to emerge at the intersection of TCM and AI, offering new hope for patients suffering from insomnia. यहाँ पे what they do is they highlight how global and how huge of an issue insomnia is and what kind of relief the intersection of TCM and AI offers to counter this issue. This is what you want to do in your conclusion. You want to sum up what you said previously throughout your paragraphs, throughout the body, and then you want to leave the reader with something to think about. And that basically sums up this letter. And now I'll hand things over to Abdullah so he can go over the second one.
Okay, so we have discussed the general letter to the editors, and now I'm just going to quickly talk about the critiques. So, critique articles, is my screen visible? Okay. So, when we discuss the letter, which the critique letters, those are the letters जिसमें आपने ये देखना होता है कि you need to uh, carefully use the sandwich methods, right? So, sandwich method में क्या होता है कि you carefully address the topic which you want to cover, but at the same time, you're not exactly making a critique on the author itself or the reputation of the author or their publications, right? So, इस तरह से if we start with the summer syncope syndrome, this is a very admirable letter that was published back in 2014 in the American Journal of Medicine, which is a very high impact factor. So it starts off by saying that given the health burden of syncope, the innovative efforts made by Huang et al. Now, et al. Means and others, so you use this in your terminologies, in establishing the possible association between antihypertensive medications and summer syncopal episodes are to be congratulated. So they start off by actually admiring how the article was written, and they actually admire how the author has studied it, right? So, however, we believe that the authors have drawn spurious associations, raising severe concerns on the validity of the findings, right? So, for instance, अब जो चीज देखने वाली है कि in your critique, you're not, I mentioned this previously as well, you're not supposed to make paragraphs based on introduction, body, and such. If you change your point, you're going to change your paragraph, right? For it is stated the incidence of syncope rises during summer. However, the study identified more syncope cases in the winter. And then subsequently, उन्होंने साथ-साथ data भी दे दिया, right? 251 compared with 245 summer syncope cases. It is very important for you all to understand that quantitative data is much more reliable than qualitative data. So whenever you give a figure, that already increases your chances of acceptance. The antihypertensive use was greater in the winter group compared with the summer group. 31%. Yep, they mentioned it here as well. The authors have not highlighted whether this difference that existed. Now, this line is very important, is statistically significant, right? So, anything that is not statistically checked, analyzed, such as the p value, which unexplained, along with confidence intervals, those are not good studies per se. However, the higher prevalence in the winter group questions the conclusion of antihypertensive medications being the main causative agent of summer syncope, right? So they ended on a very polite note, right? So the incidence of syncope is known to be positively associated with age. यहाँ पे उन्होंने उस आर्टिकल को रेफरेंस नहीं किया, उन्होंने एक और इंफॉर्मेशन को यहाँ पे लाए हैं which can be relevant to their conclusion, what they want to say, state, right? Making it critical for the readers to know the mean age of both the groups instead of just the percentages, right? So we furthermore, as the primary outcome of the study was clinical dehydration, we believe now I want you to see the wordings that they use in this letter. We believe, right, the methodology was not rigorous enough. So they've not mentioned that's not rigorous. They mentioned that's not rigorous enough. So they do take heed, or they give the merit to that the study was done really well, but not enough to suggest, right? ये wordings आप लोग this suggests that antihypertensive medications were the main contributing factor. For instance, simply the hot, dry weather could have resulted in the dehydration. So now, even though they're giving opinions, they have backed it up with the evidence that they're stating here, right? The authors should also have considered including dehydration markers such as hemoglobin and blood urea nitrogen, creatinine ratio at baseline for both the groups. So even if this is the body, वो साथ साथ अपने opinions के साथ fact based evidence based medicine के साथ वो अपने opinion को strengthen कर रहे हैं. In addition, with clear evidence from previous studies that diuretics increases the chances of dehydration, alpha blockers causes lightheadedness. See, so this is where they reference it again. It is vital for the authors to mention the type of antihypertensive medications used along with the mean number of antihypertensive agents as well, right? तो उन्होंने statistically इतना accurately उस चीज को नहीं बताया, उन्होंने various types, various modalities को नहीं consider किया. which they found out. So when you're critiquing something, you start off with the जो शुरू में उन्होंने बात की थी कि you address that how they wrote the letter in a very uh, legible way, in a very good way, right? In a very academic way. But then you start to address the small errors in those letters, while saying that, while not suggesting that it's of completely no merit whatsoever, but in a very suggestive way. So also with other factors such as insulin, tricyclic antidepressants, right? So finally, a multivariate regression analysis rather than a Fisker's exact test is the appropriate statistical method. So यहाँ पे जब हमने शुरू में बात की थी, हमने यहाँ पे ये बात की थी कि conclusion में आपने ये बताना होता है साथ साथ कि you're actually giving them something to work with. You're giving them a strategy, or somehow they can implement what we are trying to tell them. ठीक है, हम उन्हें कह रहे हैं कि आप ये करें, ये मसले हैं उसमें, तो आप उन मसलों को एड्रेस कैसे करें? सो एट द एंड ऑफ इट दे आर एक्चुअली गिविंग अ रीजन और समथिंग that they can use to address it. We feel, we feel these are the terminologies due to the above mentioned limitations in the study. Limitations don't make a study completely neglected. It's just something that adds bias to it, right? That does not mean the study is completely wrong. The potentially fatal flaws in the study design, the findings must be interpreted with caution. Larger and well-conducted studies will be required before the recommendation of decreasing the dose of anti-hypertensive therapy in summers can be considered. So it is very suggestive. And the references that they used were all either from the same journal, right? Or they used journals which were indexed in Google Scholar, PubMed, and all the good databases as well. So that's pretty much the end of our letter discussion, and I will stop sharing my screen now, and uh, that's it. So if you have any more questions, you can ask in the chat box and we will reply to you right now. So Rafiz asked, we can
Yeah, Abdullah, go
Rafiz
ahead.
asked, can we get the slides in the group chat? We will be sharing the slides, and if you will ask, but Iman, you were saying something?
Yeah, so I was just saying that we'll share the sites with you in the group. We'll share the sample LTs as well. Make sure that you attend the in-person session on the 1st of October, because we'll be going through the structure of an LT quickly. We'll quickly revise it again. And we will also go through a sample LT once again with you guys. So don't worry about that. And also, I would advise you guys to start looking up articles yourself as well. We could simply share these sample LTs with you. Lekin if you go on PubMed and do a literature search yourself, that's going to help you the most. And that's also going to, make you accustomed to PubMed and to how to search for articles, how to look for relevant articles. Okay? And a question that was raised during the session was that how will we know that an LTE has been published already on a specific topic? So you need to obviously make a search string and generally look at the articles that have been published on that topic. And even if there is an LTE on that particular topic, you can still write on it, but just make sure that you're not submitting to the same journal and that the topic is not too old and is still relevant. Okay? As I shared a review that I received on an LTE that I wrote, they told me कि ये 7 months पहले हुआ था and there's no new information on it, so this is useless, and they just rejected it. ठीक है? So just make sure that whatever you're writing on, it's relevant. Um, I think a general cutoff point that you can use is like 1 to 2 months maybe. Again, this varies a lot. You have to keep trying. हो सकता है कोई और journal होता वो accept कर भी लेता 7 months or 7-month old news. So it really depends. But to be safe, you need to make sure that you're writing on something that has happened recently. Once again, I'm sharing the WhatsApp group link once again so that you guys can join it. Make sure you're there for the session. Make sure you're registered for the session. Okay, we have another question. Once we have identified a topic to write about, what's the next step? The next step is following all the steps that we've outlined for you today in the session. You've identified a topic, you start writing then. Okay? You could also use the approach that I suggested कि पहले आप journal देख लें, उनकी author guidelines देख लें, and then start writing. But this is kind of like a reverse process. Usually ये नहीं होता. Obviously, आप पहले लिखते हैं and then you look for the journal. But with LDs, because not a lot of journals accept LDs, and even if they do, sometimes they don't accept uninvited LTEs. So it's better if you look for a journal first and look at where people are publishing. ठीक है? So आप LinkedIn is a good resource to see कि कहाँ पे लोग publish कर रहे हैं LTEs, ठीक है? Because obviously on LinkedIn you find a lot of people sharing these articles, but usually they're people who are, just starting their research career. और यूजली वो अपनी हर चीज़ अपडेट कर रहे होते हैं एंड वही लोग होते हैं जो LTs लिख रहे होते हैं स्टार्ट में एवरीवन स्टार्ट्स विद LTs राइट सो LinkedIn is a good resource to look for where people are publishing their LTs and it's also a good resource for networking, so there is that. Also make sure that all of you are in the CHSR alerts group as well. We'll try to share the link once again in everyone's class groups so you can join if you're not there already. We regularly share updates about our sessions as well as any other opportunities that may arise, including within the college and outside of college. So make sure you're in that group as well. And that is it from our side. I'm looking forward to seeing you all on the 1st of October at 2:30 p.m. in the E-Lab. Thank you so much, everyone.